Real men take care of themselves so that they can take care of those around them, and they need a healthcare provider that understands them. Men, we understand your concerns. You got a lump, a bump, or tender feeling in your genital area, you're worried it might be something serious but you don't know where to turn? Well, turn to us. If you are wondering whether or not we can help, here are just some of the conditions we see and treat every single day. On the penis or the scrotal sac, skin tags, moles, or bumps could all contain the human papillomavirus, otherwise known as HPV, while blisters, red dots, or rashes could be a sign of herpes. Any hardness under the skin of the penis could be a traumatized blood vessel, or it could be an injury to the penis internal framework. A hard callus or persistent inflammation on some or all of the penis could be a penile cancer. A palpable mass inside the testicle or in the tube that drains it should also be tested for cancer. In the case of the tube, those masses could also be a cyst or a tube obstruction. If fluid is collecting around the testicle, this could be a sign of a hernia, of internal inflammation, or again of testicular cancer. If the cord itself is unusually thick, this could also be a sign of dilated scrotal veins, varicoceles. Swelling in the groin could be an inflamed lymph node caused by the urethral infection, or it could be another sign of hernia. Pain in this area might actually be referred pain, signifying problems elsewhere, for instance, inflammation of the genital ducts or the testicle. Pain around the rectum could be an obstruction of an ejaculatory duct, pelvic floor spasm, or it could be a prostate infection. Pain under the urethra is another sign of prostate infection, but it also could be caused by urethral inflammation or urethral scarring. Pain in the bladder or around your belt buckle could be caused by an inflamed prostate, an obstructing swollen prostate, bladder cancer, or a urinary stone. Whatever your symptoms, our experienced practitioners have all of the advanced diagnostic tools they need to get straight to the root of the problem and identify the cause. We can remove lesions and send the tissue for analysis. Blood tests and advanced cultures can also quickly identify less visible but no less troubling conditions. We use ultrasound imaging to evaluate structures of the testicle and endoscopic procedures to inspect the urinary tract and pelvis. Whether we're the first clinicians you see, or you want a second opinion on a persistent problem from a practitioner you know and you can trust, make Man Centers your next port of call.
I was too embarrassed to talk to my regular doctor, but I knew when I came through the door at Man Centers, I had come to the right place. It makes so much difference talking to a doctor who gets you. No judgment, just support. That's exactly what I need.
When it comes to healthcare, real men don't just ignore their problems. They get help from the one place that they can be sure understands their needs.
The Y Factor, dedicated to men's urological wellness. Schedule your appointment at mancenters.com.